Thank you for tuning in. By the way, just one other thing I want to mention. Every single interview, every single episode in full, everything we do here is archived and on YouTube. And if you just go in and you type Megacast and you type Taweel, now you'd never know how to spell it because that is the craziest last name I've ever run into, but it's actually, I think, Taweel. And if you go in and you do that, then you're going to be able to see all the interviews that we have done with our next guest. And it is Dr. Jamie Taweel, internal medicine specialist at the Grand Rapids Medical Associates. Doc, welcome back to the show. Good to see you.
Thank you for having me. How are you guys?
We're doing good. Speak up as much as you can. Our audio, for some reason today, from Zoom seems to be a little bit weak. So my two favorite bearded individuals, I understand, were together recently. You and Captain Jeff of the show. And, you know,
Yes.
it's actually a really interesting case study before we talk about how his ankle is. But, he didn't really want to go see a doctor, and maybe that's just natural for Jeff. I mean, listen, I'm not going to pick on him. I don't love going into doctors' offices either. But it was really hard, for him to get in and finally get a chance to see you. But that has happened. Is that correct?
Yes. Yeah, I had a chance to see him yesterday in the office.
Excellent. Is his ankle going to be okay?
He's going to make it. I think he's going to do well.
He keeps telling me that it's so bad that he can't come to work when things open up. He's going to have to, stay at home with his leg elevated and can't. And you've prescribed him 3 months in bed and that he's not really going to be able to do any physical work ever for the rest of his life.
3 months in bed. I gave him a raise and all that.
Yeah, the raise, too. No, I'm glad he's doing okay.
No, he's got a pretty torn up ankle, but I think he's going to make it. The X-rays were negative. He has no evidence of a fracture. He's, I hope he's okay with he's doing well.
All right. Well, that's good news. Glad to hear that. And it's just a reminder that if you have something going on medically, go. I mean, in the past, all we were doing was doing telemedicine, but you have now shifted from pure telemedicine to some telemedicine and then people coming in the office?
Yeah, I'm doing a bit of a hybrid. So what I'm doing is I have limited patients that I can have in the office, and I'm sure Jeffrey can explain. We've spaced out the amount of time between patients, and we've done that so that patients aren't meeting each other. People are coming in. When you come to my office to see me, the office is dead. I mean, there's no one else in there. And it's like that so that patients can come in, be seen, leave without running into other people, and then also allow for time for the room to get turned completely over, completely sterilized, and go through an entire protocol. So when you come in the door, you're going in through one door, you're leaving out another. It's kind of where, we're creating a situation where people aren't going backwards and bumping into each other. And in between those times, I'm doing telemedicine appointments in my office like I'm doing right now with you, these Zoom type things where I can address patient issues for patients that still don't want to come in, or also patients that still feel, they may have issues that need to be seen by a doctor, but they don't quite know if it's something they want to be seen for. So this is a good way to kind of address that. So I'm doing both, trying to just keep it busy.
Joining us now is Dr. Jamie Taweel. He is an internal medicine specialist. So that sounds like a good plan. By the way, we have a great video that Jeff did shoot when he was in your office yesterday. I can't show it right now because of some technical issues. Did he tell you? You look like you're surprised. You know about the video?
No, I know he was filming. I was just kind of wondering what would be great.
Well, he told me it was great. I haven't seen it either. The thing might stink as far as I know. But no, he said it was a really...
I don't know if it's a compelling video about an office visit. But
Well, listen, it doesn't take much to get us excited about things in this show. But it's an important story. And he shot it on his phone. So we'll see. We'll show it Monday and try and get it up on the web over the weekend. But it's I think people just need to see. We could talk about this all day. It's a very different experience going to your office, Dr. Jamie Taweel, and I'm sure the same is true for a lot of other medical practitioners as people open up their offices. So we want people to see what's going on now that we can get out and tell the stories, so they can maybe get some comfort, and maybe it'll help somebody who might tune in to say, okay, that's not so bad. I can go see Dr. Taweel. It'll be fine. I'm not going to get sick.
Well, I'm hoping so. I mean, I do like the fact that patients are a little bit less reluctant to come in to see their doctors. We are getting more patients, getting a lot of calls. And that's good. And it's also probably taking a lot of the load off of the emergency rooms that are getting overwhelmed by people who just don't want to see their doctors. But at the same time, there are people that don't even want to go to the emergency room because they're concerned that that's going to be a place where you would go to get COVID as opposed to get treated for it. And they're doing an excellent job of trying to separate anyone that has any type of risks so that you can avoid and mitigate that risk as much as possible.
All right, so that is going on, but we can't say it enough, and that's why I appreciate you taking time today to remind people, look, if you have something going on, go see your doctor. And I assume a lot of family doctor practices, family practices are getting caught up now. So in the next couple of days or weeks or months, you probably be able to get in even for your routine physical and checkups as well. Yeah, is that beginning to happen in most offices? Okay.
Yeah, absolutely.
All right, Dr. Taweel joining us here, Dr. Jamie Taweel. Just a couple other things, and we'll let you go. We got a pretty busy day going on here. I'm going to head out in a couple of minutes to cover my first story out in the field, and Tyler's going to take over here, and so there is a scheduled protest going on, and we're going to go. So. I'm just thinking. So, what do I need to do to gear up? Gloves, mask. What do I do? Because I'm watching these protests on TV, and people are just totally blowing off everything we've been talking about for the past couple of months. And not everybody, but enough people that I've been concerned. So I want to make sure that I'm masked up. So what do I need to do today, Doc?
Well, it sounds like you're doing the right thing so far. And here's the thing. It's an emotional scenario, and people, when they get emotional, are going to forget all of the things that are really important. And so you have to just kind of remind yourself that despite the fact that this is a very emotional, high tense situation, that safety is going to be number one. And, but so to answer your question, basically, you're going to want to wear the mask. You're going to want to wear the gloves. You're going to want to avoid, obviously, prolonged exposure to people that are not. If you are wearing a mask, you are protecting yourself, and you're also protecting the people around you from, if you were to, God forbid, have something, you're also helping protect the other people. So you're a one-sided situation where only one person's wearing the mask is still going to be more beneficial than if you weren't wearing one at all for both people, believe it or not. So I think as long as you're able to do that and just limit exposure, people that aren't wearing masks, try to limit exposure. They're starting to show studies where the amount of time spent with exposure is also just as important with regards to how, whether or not you are going to be a person to contract this, as opposed to just a split-second exposure to somebody that's going to be, you know what I mean?
Yep, I get it. Dr. Jamie Taweel joining us, internal medicine specialist, Grand River Medical Associates, and our go-to expert on everything in the doctor world over the past couple of months here on the show. I really appreciate you being with us again. So good advice. So I'll mask up. We'll get the gloves. Got to find the gloves. I know they're here. And there'll be no facial covering displacement during our broadcast today, right? Was that your term, or was that his term, or was that another?
No, it was
time?
not mine.
Okay, we had another.
That was Greg Flynn.
Yeah, that was Greg Flynn from the West Bloomfield Fire Department. But you got to keep them. If you're going to wear the mask, it's got to cover your nose, right? Or it's pointless, right?
Absolutely, got to cover the nose. Got to make sure that it's going to be here, down. And you're going to do the best you can, and just, again, try to do social distancing. I don't know how far your arm reaches with the microphone if you're going to be doing any question and answer, but I think you'll be okay. As again, it's an emotional situation. Try your best to.
Might not be any interviews today, because I've seen a lot of the TV stations have this 6-foot microphone pole, and I don't know that we can get one of those. We do have one, though, back in the shop, Tyler. Maybe we can grab that real quick. The boom mic, yeah, okay. Hang on just one more second, Doc. I got one more question for you, but we need to thank our radio stations, WAHS Auburn Hills, WBFH Bloomfield Hills, and WBLD Orchard Lake. One other quick question for you. So we're seeing now that the vaccine testing is going into phase 3, and that means that we got to get the vaccine out. Dr. Fauci said 30,000 tests they want to do, half placebo, half with the real vaccine, and they need to get those out. But crazy things happen around every corner these days. There may not be enough people to actually conduct the tests now. Have you heard that? Does that make any sense? The COVID virus is so under control that finding the 30,000 people, I know you're looking at me like I'm crazy, but finding the 30,000 people to test might be a problem. Finding 30,000 people that are appropriate for the test may be a problem, unless I'm misunderstanding the story.
My first time hearing that, so I'm not 100% sure about that. The question is whether or not we can't find 30,000 because we aren't able to test enough people to determine whether or not 30,000 people have been infected versus people that had it that were confirmed that have unfortunately passed away. It becomes a bit of a discourse to try and figure out exactly how to get the right amount of people to be tested, confirmed, and then plus if you're doing a vaccine to determine whether or not the vaccine is going to help someone who hasn't been infected versus someone who's already been infected. And
I think if you're going to test a vaccine, don't you want to test the vaccine with people that have not been infected? Isn't that the idea?
Yeah. So
it should be easy to find 30,000 people who haven't been infected, I would think. But I don't know. As usual, I took 10 seconds to read the story. I'm probably confused. Is it a good thing, though, regardless of whether they'll find the people to test, and I'm sure they will, it's got to be a good thing that we're at phase 3 of the testing. Your thoughts?
Yeah, phase 3 is further along, so they're definitely moving at a pretty good clip. The only problem whenever you rush these things through is that you don't have long-term results. So the question remains, will the vaccine work? But not only will it work, but will it work for a long period of time? If it gives someone 6 months of immunity and then all of a sudden they are now at risk of getting it again, this can be problematic. So again, I'm not trying to throw water on any of the excitement that's going on, but there's always needs to be a modicum of cautiousness to try and keep, not just let everybody, immediately go, all right, vaccines, we're back to normal. And then all of a sudden we're in the middle of a second wave or something like that. Yeah. So I do think phase 3 is excellent. These are, more clinical phases. So we're already past a lot of the legislative hurdles essentially and that need to get done. So things will start hopefully moving faster. I fingers crossed, but things do take time. So I do caution patience.
All right. Well, we will all be as patient as we can be, but I know everyone is eager to get a solution and get a vaccine. Dr. Taweel, thank you very much. I appreciate all your thoughts today. Good to chat with you again. Thank you very much for taking really good care of Jeff. We appreciate that. And if folks want to come see you, because Jeff told them that you were a great doc, and they've been watching you here on Civic Center TV, how do they get a hold of you?
Just Grand River Medical, all one word.com, grandrivermedical.com, and 248-264-6169. And any questions, please feel free to reach out to me anytime, guys. I really do appreciate you guys having me on the show, and I'm always glad to be here.
Well, and now that things are getting a little bit better, hopefully we'll have a chance to meet in person. Dr. Taweel, thank you very much for joining us again today. He is Dr. Jamie Taweel, internal medicine specialist, and our go-to doctor right here in the MegaCast.